Hello class, welcome to our chapter 13 lecture on substance use and misuse. Today we're going to talk about addiction, different types of drugs, and then as well look at some of the effects of alcohol and tobacco use on our overall health. Okay, addictive behaviors are habits that have a negative effect and have gotten out of control of the person who is having those addictive behaviors. So they're unable to stop pursuing those behaviors, and those behaviors have negative effects. So they're habits that have gotten out of control. And these addictions often start because some piece of that addiction, that behavior or that substance, uh, brings some kind of pleasure or causes some avoidance of pain. So then that behavior becomes a central focus of that person's life, because it allows them to escape whatever pain they're feeling or brings them pleasure that they're not getting somewhere else in their life. And then there are some risk factors for developing addictions. Certain personality types are more prone to addictive behaviors, different lifestyles, heredity, so where you come from, your family tree, your genetics, your social and your physical environment. So if you're around more addictive substances or around more behaviors, you see those behaviors as normal, you're more likely to engage in those. And then also the substance itself can have some addictive qualities chemically within the brain to keep that behavior and reinforce that behavior. Okay, some general pieces that are associated with addictive behaviors are reinforcement, so that substance is giving a positive feedback to your brain to keep doing this, keep having this behavior. There may be a compulsion or a craving, so where you want that behavior or want that substance. There's a loss of control, unable to stop yourself from these cravings or avoid them, may escalate, and then has negative consequences. So some aspect of that behavior is negatively affecting that person's life. Okay. With substance misuse, this is when we're using substances that are outside of legal guidelines or taken outside of medical guidelines. So there's a difference between misuse and abuse. Abuse is really the intent to overuse, when misuse is using it outside of its context or outside of what it's supposed to be. So there are different medications, there's different types of drugs and substances that are legal or medically prescribed, but if we're using them outside of those boundaries, it becomes substance misuse. And if we are overusing, and overusing for some kind of maybe more negative direction, that's the intent of our use, that can make it more into substance abuse. So that's kind of the overuse, especially outside of these guidelines. Okay, and then addiction causes disruptions within the brain. It changes how your reward, motivation, and memory are processed, and how they are associated with those certain behaviors. So some of those behaviors or those substances give a positive feedback to the brain, even though it has a negative consequence for the body or for overall health. So it causes you to compulsively use and continue to use that substance or that behavior despite any of those negative consequences. And this becomes a disorder within the brain. It causes some changes into how we can control our body, control our social circle, how we work within that social circle, changes our risk and risk avoidance patterns, and those effects of the drugs or whatever substance you're using can lead to some more negative consequences. So really the basis of this is that this behavior is compulsively used. So we're constantly using it. We can't control our ability to use the substance or to avoid the substance. and it has negative impacts on our life and our overall health and wellness through multiple different spectrums. Okay. There are some other examples of addictive behavior like compulsive gambling. So gambling is not a substance use, but it is a behavior where it's compulsive risk taking for the chance of possible reward, even if there are negative consequences like loss of financial stability, changes within your social status, possible loss of the ability to engage in normal social outings and things like that. There could be work addiction, okay, where someone is compulsively addicted to their work. Okay, they can't not be performing their work, and it has negative consequences, maybe socially or other areas. There's all these addictive behaviors may have rewards, so that work addiction may have a reward of increased financial stability, more money, more social status, but at the same time, it does have negative consequences for overall health, maybe escalate stress, and limit social wellness, things like that. There's things like compulsive buying, okay, that's like shopping addiction, or internet addiction, these behaviors where you can't avoid performing that behavior because of that reward, even though it may have negative consequences on your life, your finances, your health, your wellness. There's also compulsive exercise. So even things that we think of as good, like exercise, we know that exercise is great for us, but that can become compulsive if we can't stop that behavior or we can't control that behavior. And we see this a lot with the female athlete triad. Comes in with compulsive exercise as one of those pieces. So we may be exercising because we get that high of the endorphins that come with the exercise. We feel good about ourselves. We feel positive, even if it is overtraining us and burying us down into a physical depression of our immune system, our hormone function, our bodily functions. And then there's other ones such as sex addiction, eating addictions, television addiction. So all of these are just behaviors that we can no longer control our interaction with that behavior, and there's a negative consequence with it. That's what falls into addictive behavior. Most of the time when we think of addictive behavior, we think of it with different types of drugs. So the use of drugs is often by people who are of a higher risk category or take higher than average risk. So most often these are, or the higher risks for using drugs are being male, young, having trouble adolescence, thrill-seeking behaviors, dysfunctional families, peer groups that accept drug use, lower socioeconomic status, and things like that. So your environment can play a role in your chance of that first interaction with the drug, which can then lead to a drug addiction. So the one that I really want to talk about is the use of opioids, or think of these as, so these are prescription painkillers or prescription opioids, such as morphine, codeine, OxyContin. These are pain relievers or pain suppressants, but they also give this kind of euphoric feeling because they are opioids. So other opioids that you may be familiar with are things like heroin is an opioid. So it interacts with our brain similarly. It has that same addictive quality where it changes the chemical structure in our brain, forcing us to want to compulsively want to continue to use those even if it has negative consequences. And the overdose deaths from these prescription opioids that are misused outside of prescription. So maybe you're no longer being prescribed these opioids, or maybe you had a surgery or an accident, you were prescribed them. Now you're compulsively using them, and now you're finding other ways to get them because you're no longer on that prescription. Those death rates are running up higher and higher and higher, and are leading over those that are from illicit drugs rather than prescription drugs. Prescription drugs, especially prescription opioids, are rising in popularity, especially within middle-aged adults. So watch out for these. If you're prescribed some kind of painkiller that's an opioid, Make sure you're wary about taking those opioids and know that they do have addictive qualities and you need to manage how you use them, um, and your perception of them so that you don't become an overuser or an addictive user. Okay. And those overdose deaths are especially in middle-aged adults. So think like you or your parents could be those that are at higher risk for using and misusing these prescription opioids. So we want to make sure that we're aware. Ask your doctor about the medication, about any qualities, like, hey, does this cause addictive behaviors? Is this a problem? How do I avoid becoming addictive to these prescription drugs, these painkillers? There's other illicit drugs that you may think of. You've probably heard enough about these different types of illicit drugs that cause a change in your mental state. They either decrease pain, they ramp up perceived energy, make you feel a different way, and then that causes this positive reinforcement within your self, which causes you to want to likely continue to take these drugs. Or they are illegal drugs that you're misusing or abusing in a way to change someone else's status. So be aware of these, understand that they are out there, and understand that they can cause addictive behaviors. Okay? Even if the substance isn't itself causing addictive qualities or changes in the brain, it can cause habit-forming behavior, which can lead to a chronic misuse and overuse of those illicit substances. So my best recommendation is just stay away. Okay? The best solution to avoiding this is to build self-esteem, especially in young individuals. So because young individuals are at the highest risk for starting addictive behaviors, especially illicit drug or substance use, and then improving their academic skills, improving opportunities for recreational activities, and then being honest about the effects of the drugs. Don't try to use different fear tactics. Be straight up and tell them what it actually does and what are the consequences, and maybe the consequences that fit more to what they notice. Not those long-term consequences, but maybe the short-term ones that can make them really try to avoid those substances earlier. And then teaching them strategies for resisting peer pressure is always good so that they can have the power, they have the self-esteem, they have the confidence to say no to something they don't want to do. Okay, and then if you are using illicit substances, I'm not trying to point a finger, okay, just consider the following questions. What are risks involved? Okay, is using this drug compatible with your overall goals in life? What are your ethical beliefs about drug use, especially specific drugs? What are the financial costs? And then are you using this drug as a way to solve a deeper problem? So just kind of think through those. If you do use illicit substances, hey, that is your choice. But consider the following questions and maybe make a directed decision that makes sure that your habits and your behaviors align with your overall morals. Next, we'll talk about alcohol. Okay, responsible use of alcohol means that we are keeping our blood alcohol low enough so that our behavior can be held under control. Once the blood alcohol concentration, BAC, is too high, it begins to inhibit our behavioral control, and that's when we start to see a lot of those negative consequences. Okay, the concentration or the proof of alcohol differs between different types of alcohol, but that proof value is 2 times the concentration percentage. So if you see something is 80 proof, that means it is 40% alcohol per volume. We also have these levels of what is called a standard drink. So each of these drinks is about 0.6 ounces of alcohol per drink, which is 1 12-ounce of bottled beer, about 5% alcohol, 5 ounces of table wine, which is normally about 14% alcohol, A cocktail with 1.5 ounces of 80 proof liquor. So this is also lower if we have something that's maybe 90 to 100 proof. That level would be lower, but all of these is about 0.6 ounces of alcohol per drink, or a standard drink. And then this alcohol, or this ethyl alcohol, has psychoactive properties within our brain. So it interacts with our brain after it's absorbed into our bloodstream through our stomach and our small intestine. We try to metabolize this within the liver, which turns that alcohol into energy. So alcohol does have calories. It has about 7 calories per gram. So over-consuming alcohol can also have some negative physiological effects when it comes to weight gain, especially if we're not using that energy. But that alcohol concentration, their blood alcohol concentration, so you've absorbed that alcohol into your bloodstream. Now it's moving throughout your bloodstream. It's going to different parts of your body. It's going to your brain. And then that affects, or that determines the effects that that alcohol will have on that person. So your blood alcohol concentration depends on how much alcohol you consume, your heredity, so your genetics, your body weight, and your amount of body fat. So your size and your weight and your body fat percentage do affect your blood alcohol concentration. But most individuals can metabolize about half of one standard drink per hour, or 1 drink every 2 hours can be fully metabolized on average. So this is generally, wink wink, you should know this. So 1 drink every 2 hours, or half of 1 drink each hour, is about what we can metabolize. So if we can consume if we are consuming alcohol in moderation, we're consuming somewhere around 1 drink every 2 hours, we will keep our blood alcohol concentration very low and under control. Okay. If you drink slightly less than that each hour, you'll stay very low. And if you consume more alcohol than you can metabolize, your blood alcohol concentration will increase, and you will become drunk or noticeably intoxicated because your blood alcohol concentration is too high. You're unable to control your behaviors, which is most often what we see when someone is drunk. So some of these dangers that happen when we become intoxicated through alcohol: impaired judgment, weakened sensory perceptions, we don't feel as well, we don't make good decisions. We have reduced inhibition, so we're more likely to take higher risk behaviors. We have impaired motor coordination, so if you are trying to walk around, run, drive, move, you have impaired coordination, you're slow to your movements, you're more likely to make an incorrect movement or not move quick enough, especially if you're driving. That's why we don't want to drive while we've been impaired through alcohol, because we can't perform the same motor skills that we maybe think that you can do. You can't perform that same movement. You're already slowed down in a slower state through your motor coordination. It can also increase aggressiveness and hostility in some people. So you're more likely to take that next hostile step rather than having good judgment and thinking before you act. And it does put you at a higher risk for suicide and alcohol poisoning, because you have impaired judgment. You're more likely to consume even more alcohol, which can lead to alcohol poisoning, which can cause death, or if someone's in a state where they are more at risk for suicide, it can push someone over that edge. So we want to be aware of the dangers outside of just the alcohol consumption. And it can also have negative consequences overall. Can put you into dangerous situations, okay? Put you behind the wheel when you're intoxicated. You're not making the right decisions getting in the car. Who knows what decisions you're gonna make once you start driving that car. It can impair your academics, especially if it becomes a higher level of concern for you compared to your academics. If it gets in the way of what you're trying to do professionally or interpersonally, it can also put you into legal troubles, especially if you're in dangerous situations. It can put you into legal trouble. So be aware of not just the acute or right now effects of the alcohol, but also the long-term and chronic consequences of misuse of alcohol. Okay, and if someone does have some kind of alcohol use disorder, it could be very severe. They could have problems with continuing to drink and or not being able to stop because it can cause these withdrawal symptoms. So some of the warning signs of a alcohol related disorder or problem: drinking alone or secretively, using alcohol to deal with feelings or difficult situations, feeling uncomfortable if alcohol is unavailable, and then escalating alcohol consumption chronically, so consuming more and more alcohol, especially in situations that are not often, or not just social have a drink situations. They are whenever, wherever, wake up, consume alcohol kind of things. Some of the effects from a chronic level on the body is cirrhosis, which is destroying the liver cells. You can cause digestive issues, especially inflammation of the pancreas, cardiovascular problems, like high blood pressure, leading to weakened heart muscle, which can lead to heart failure. Different types of cancers are especially linked with alcohol consumption, especially those of the liver, the stomach, the esophagus, and in some cases breast cancer. And it could cause issues with your mental state, so psychiatric problems like paranoia and memory gaps, especially with the overconsumption of alcohol. And then there's some other misuse effects like diabetes, nutritional deficiencies, nervous system disease can all be linked to the overuse of alcohol. And this also comes into drinking and driving, okay, because we know that this impairs our coordination. The United States and its surrounding, like District of Columbia, Puerto Rico, have a legal limit of 0.08% blood alcohol concentration for those who are age 21 and over. Okay, the actual level of blood alcohol concentration that is legal for those who are under the age of 21 is 0.00. So 0 is the standard unless you are of 21 years of age. But we want to avoid getting behind the wheel if we are in any state where our blood alcohol concentration can be over 0.00, because that's putting us at more and more and more risk for injuring ourselves and injuring others. Another one that relates to college is binge drinking. Okay, binge drinking is the rapid consumption of alcohol. It's consumed normally within a few hours, and it's done periodically. So on Saturday, everybody has way too many drinks and then doesn't drink throughout the week, and then Saturday comes again, happens again. This is more common in younger adults, especially those of college age, so 18 to 25. Even those at age 18, there's a 25% of Americans say that they report binge drinking in the past month. So this is very common at the college age. I mean, it's something to pay attention to because heavy drinking, especially over long periods of time, chronic binge drinking can lead to a lot of those alcohol-related disorders and physical health issues. And lastly, we'll talk about tobacco use. Smoking in general is the leading preventable cause of illness and death in the United States. And nearly 500,000 Americans die prematurely due to smoking-related issues. So tobacco itself is unsafe, okay? And we know that about 1 in 4 adults use at least one form of tobacco, and those who consume tobacco in one form, often about 40% use it in another form also. So like cigarettes, e-cigarettes, or some other combination of 2 different forms of tobacco. The number of individuals who smoke has decreased in the United States, but it's still high, and it's still something to pay attention to. Because that nicotine addiction, nicotine is a psychoactive drug that gets into the brain and causes this compulsion to consume it in whatever form. Okay, so this causes a positive reinforcement, which can lead to continued use, and when someone fails to consume, they also experience major withdrawal symptoms, which makes it so much more difficult to stop consuming nicotine through tobacco, or often through tobacco. So there are some other health concerns, okay, issues with carcinogens or cancer-causing chemicals like carbon monoxide. It interferes with functions of our respiratory system and with our life expectancy, quality of life, and for the health of people around us. Because cigarette smoking is linked to many different types of disease: lung disease, diabetes, cardiovascular disease, cancers, tooth decay, bad breath, hair loss, discoloration at the teeth and fingers, menstrual disorders, fire-related injuries. So there's all kinds of different negative consequences that come with the use of tobacco, especially cigarette smoking. And because it causes this positive reinforcement within the brain, it is very difficult for that person to stop engaging in these behaviors, even if they have negative consequences. So to give up tobacco, it's a long-term, difficult process, filled with cravings, physical withdrawal symptoms. And the best way to start is to keep track of cravings first. Find out when and where and what triggers you to consume that tobacco, what triggers you to have that cigarette or whatever you're using as a tobacco or nicotine product. Keep track of those and put yourself in situations where you can maybe avoid those situations that cause cravings, and slowly over the long term, because it's a long term, pretty much a forever process, and continue to work your way down. Use that same relapse and then behavior change model that we talked about earlier this semester. Relapses will occur. It's how fast you can get back on the train and keep going. All right, thank you very much for our lecture, and I look forward to our next one.